So, good morning, everybody. And again, I want to thank all the essential employees that are out there doing their job day in, day out, so they keep us moving in the right direction. And to everyone staying home doing the right stuff, thank you. To everyone that went out, probably enjoyed this weekend. Hopefully you did it staying 6 feet apart, wearing a mask, coughing into your arm, and cleaning your hands constantly. Because we'll know probably 10 days from now where we stand. And that gets me to some of the good stuff that's been going on. Our numbers today are 1,639. Now, I just want to explain this because yesterday we were at 1,640. Three of the cases that we had were actually Rensselaer County, so we gave them back to Steve McLaughlin, so that brought us down to 637, but we picked up 2 yesterday, so that brings us up to 639. So it's a little bit of difference there, but it's good stuff. That means we went up 2, which is all good. We have 862 people under mandatory quarantine. That's down 38, which is good. We stay 5 people under precautionary quarantine. It's the same as yesterday as it is today, so which is good. We have 4,378 people have completed quarantine. That's down 117 from over the weekend, so which is going in the right direction. Out of those, 1,200 tested positive for the virus and have fully recovered, so that's up 41, which is also good. So some of this stuff that we have to track, right, when we do the control room meetings and the conversation, the biggest conversation piece that we have through the whole matrix is basically how the hospitalization rate is and how many hospital beds are available. So one of the alarming things is now we're up to 33 people in the hospital. That's up 5 from yesterday. So we jumped 5 in our people in the hospital. So that changes our hospitalization rate to 2.01, up from 1.77 yesterday. And that's a number we watch too, besides the positive cases. It's the hospitalization, ICU, that type of stuff. Which can set us back, and that's why we've been worried and cautioning everyone to do the right thing. Stay home. We're not trying to scare you. The virus didn't go away. I know people have said to me, and I said this the other day, they're done with this, they're moving on, but it's not done with us. So until it's done with us, or we get a vaccine for this, where this is going to be the new norm. So we have 3 people currently in the ICU. That's up 1 from yesterday and 1 from Saturday. So we climbed up back in the ICU a little bit. So that's the other number we're watching. So we got 3 in our ICU. The average, though, for the last 5 days is 12.2 new cases, which is good because yesterday we're at 17.6, so that's steadily going down. And I know some of the questions we got back from a lot of people were on Facebook and email was, well, on the weekends the numbers seem to be lower. You're correct. We say it ourselves all the time. It always seems that the numbers are lower. We check it, and then sometimes it would spike up on a Tuesday, Wednesday, but they've been steady now, which is good. I'm always cautious on the weekends for some reason with the results coming back, but I can't explain it, other than that's when the labs give us what they give us. So you got to remember, I urge anyone to get tested that has signs and symptoms, and we're at the point now that you should just go get tested if you can. Because you should know where you stand, because hopefully when we get into phase 2, everyone's going to start going back to work. You got to remember, we've been very aggressive here in Albany County, in the capital, with Rensselaer County now on board, in Schenectady. We're moving in the right direction. We're getting everyone tested that we can, especially essential employees. Continue to get tested so we can move forward. So please go to our mobile test site, which is area code 518-465-4771. That's area code 518-465-4771. Just to let you know, we have conducted 1,377 tests at our mobile testing sites. I wish that number was higher. We can set up, but if people don't come or they don't call, it's not going to happen. This is the date ahead with the Black Caucus and other people in the community. We need your help. We need to get people to sign up. We can't make them dial the phone and Dial. Wow. Yeah, no, I was thinking the rotary. Yes, I dated myself on that one. You can't have people do this without your help, and we need your help in the community to reach out to your neighbors and them and set this up, because we're right there in your local neighborhood. As always, the site in Colony, the Rate Aid on Central Avenue, and you can go to their website and log on, and Priority 1 in Gilliland. And most importantly, the essential workers in the drive-through at UAlbany, please, as always, call there. You can call the UAlbany number at 1-888-364-3065, or you can go online to make an appointment, and that's for both essential and then people going through the drive-through. At the Rate Aid site, we've done 1,300 testing so far there alone too. That's been a huge success. When I still hear complaints about people, backup of traffic. I'm okay with that, people. That's all right. You can complain all you want. You shouldn't be out anyway, right? Not unless you're an essential worker. So that's okay. But one of the things I thought it'd be good to get another update from our sheriff, who's been out there doing a great job in the community, not just through his EOC, but through his whole department, and kind of talk about what he might have seen this weekend. I was out. I did drive around, and I got to tell you, it was quiet. That means people are probably in Lake George or other places like that. But Sheriff Apple, please, whatever you want to talk about.
Good morning. Thank you. So actually, the weekend was relatively quiet. Very few complaints. Some of the folks that are complaining are, most of the complaints really, we once investigated, are not factual complaints. It was a busy weekend crime-wise, unfortunately. We did have to fire up our portable morgue for one day. It was more so, we got some inquiries as to why. It was more so over a cooling issue in one of the local morgues, so we had to use a temporary morgue. It wasn't a matter of COVID crisis of the virus deaths. Actually, right now, heroin deaths in the capital region are by far outpacing COVID deaths, and that's also something that we have to focus on as folks can't get out to meetings, alcohol meetings, narcotics meetings. Some folks are regressing, and we've had a big spike, and we've had some bad heroin and some bad cocaine come through the area. As far as PPE, we continue to give away PPE almost daily. Tonight from 4 to 6, we're in Westmere Firehouse. Then tomorrow night we go to Voorsville, and then Queemans, and then I think we wrap up in Watervliet. I've been posting them, and I'll continue to post them. We've given out roughly 200,000 cotton masks in the Capital District, specifically Albany County. About 182,000 of them have gone out in the last couple of weeks, with 20,000 going over to our nursing home and then as well to the jail. We continue to get loads in from dishes from Homeland Security to continue to give our frontline essential workers masks, proper PPE, gowns, face shields, whatever the case may be. But so far it's been relatively quiet. It looks like everybody, thanks to the county exec, has been pushing the education and awareness for the last several weeks. Geez, I think we're up to almost day 80. It's been working, and we see things going down. I do, again, want to stress that I worry a lot about our mental health. I worry about those addicted getting help, and I think that's going to be our next battle if we continue to flatten this curve and keep it down. So, thank you.
Sheriff, thank you as always, and for the work that you're doing out there with the men and women, especially in the EMS community. And I know you had a rough 2 weeks with the 8-year-old and the suicide yesterday, so it's not easy stuff to deal with on top of everything else. But Dr. Whalen.
Good morning. Just echoing something Sheriff Apple discussed, although we have not seen a lot of overdoses in Albany County, we know when this affects one part of our region, it's likely to affect other parts of our region. And this is something that we are also very committed to responding to. The county health department works with our county department of mental health to ensure that those that want to be trained for naloxone can be trained. Usually this is done in person at the department once a month, but there is now availability for those that want to be trained to do this via Zoom, and there's information on that on our website. And I would encourage those of you that have any concern about somebody in your family or people that you know to avail of that training. In terms of COVID-19, we continue to see our numbers decline, and this is a good thing. We know that a lot of what we have done across the state, and particularly in Albany County, has been successful in flattening the curve, and we encourage people to continue these behaviors. There's a lot that we don't know. We don't know whether the decline in cases is related to a possible seasonal effect of COVID-19. We also don't know whether it's likely that we may be facing another surge in the fall, which is a concern of many at the national and international level. All of these things should be informing our thoughts and behaviors going forward. So all of the measures that we continue to advocate for people to implement, including social distancing, including wearing a mask, including frequent hand washing, are more important than ever. So we continue to encourage people to keep yourself informed, to learn as much information as is available, and to protect yourselves and your families.
Thank you, Dr. Whalen, as always. And that Zoom thing is today at 11 o'clock, just so if there's someone out there who wants to hop on it, please do, by all means. And, other good news is we haven't had someone pass away since Thursday, so which is really good news. But I also want to remind everyone we launched a week of the Teen Challenge at hashtag Albany County Stay Safe on Instagram. And I want to remind the teens between the age of 13 and 18 that should show us how to stay staying safe, and social distancing guidelines, and wearing a mask, and completing this challenge. So that's good. Thank you for that. This week, I just want to remind everyone it's about distant learning, so please submit your stuff for the distant learning. And we have gift cards to go with it. It's a great partnership with AT&T and PAL, so I want to thank them, two great organizations that really have done so much in the community, especially AT&T for coming to the table and helping out in the times like this, and PAL's always doing a great job. I also want to remind everyone that for our mental health hotline, as the sheriff is saying, is an issue for everyone to deal with. Please call 7 days a week, 8 a.m. to 8 p.m. The numbers, as always, is 518-269-6634, area code 518-269-6634, and our 24-hour sexual assault hotline number, area code 518-447-7716, and as always, the 211 in the New York State hotline. Again, please continue to do the right stuff. Some of the stuff I got back on Instagram and Facebook and some other things was about people going to like different supermarkets and not everyone having a mask on. It should be protocol. Everyone in that store should have it. If not, don't shop there. We got the pause number. We put that out. We'll put that out again, that you can call to tell on these companies, I hate to say it that way, that aren't following the guidelines. They should be letting people know when they come into their stores they should have a mask on. I've been at a store to get something, and I gotta tell you, saw a customer come in without a mask, and they told them they can't come in the store until they put a mask on. So, these are things that should be happening. It should be the new norm, so pay attention to that. But